things are as good as it gets at the moment. If we were seeing COVID spread in our community, if it was really existing in our local community, we would have expected by now to either see cases come through to the hospital or to be aware in our screening testing from the last couple of weeks of seeing cases. We just haven't seen that. So at the moment, as whilst we can never be 100% confident, we think in our community, in our area, that there's no COVID being transmitted currently. I think there's a couple of things. As we loosen up the restrictions, there is also travel restrictions that get loosened, and we will see people coming into our community from outside. And as soon as that starts happening, there is a small risk of introducing the virus into our community. So therefore, even though we can visit in larger numbers, up to 5 or 10 in a group, as time goes on, the risk of COVID will still exist. And so it's really important in those settings that we maintain physical distancing, that you practice good respiratory etiquette and wash your hands appropriately and avoid touching your face anywhere on the face, because if the virus is there, your biggest risk is of self-infection from touching a surface that's been contaminated and then potentially putting yourself at risk of infection. Seeing grandparents is an individual decision, because we know that older patients and older people are at higher risk of getting more severe COVID. And if they do, that's a high risk of dying from the infection. But at the moment, if your grandparents or elderly friends are local, and you yourself have been local, and we know that the risk of COVID locally at the moment is as low as it's probably going to be for some time, we could argue if you are going to visit grandparents or elderly, that this weekend or this next week is probably as safe a time as there's going to be for the foreseeable future. Visitors are at high risk, so people coming into our community and leaving, that's when we think that's the option or the way that the virus will get back into our community, is that type of thoroughfare, which is part of gradually opening things up, is where our risk comes. And whilst we can not have a zero risk state, we understand that for lots of reasons, we need to practice all those physical distancing requirements to reduce the risk as much as possible. Enjoy the things that you have earned. We haven't got here by accident. People have worked hard by following the public health rules, and we've got to a good point that we can relax, but we can't forget everything that's got us here. Less social restriction doesn't mean more physical contact, and we need to be able to separate those two out, so that if you practice good physical distancing, then we can keep COVID at bay.